Regarding my own patient group in my post-operative follow-ups, I have never once seen a patient of mine whose ears fully reverted to how they were before. Depending on the technique, do we not face cases requiring revision or issues where the ears open up? Yes, we do. In the classic way, the chance of needing a revision, meaning a minor follow-up procedure, is just 1 to 2%. For thread suspension, it is 5 to 10%. Especially when determining our technique, when deciding on the method for surgery, if we set our indication well, and if we set it accurately, the chance of the ear opening back up is extremely low. Of course, here we are talking about spontaneous openings without any trauma. As mentioned, the rate is 5 to 10% for thread suspension and only 1 to 2% for the classic method. So, when I speak of this opening, I am referring to 1 to 2 millimeter gaps. Dear viewers, does the ear revert? In my own case group, I have never seen any patient I operated on return to their preoperative state. Of course, we must be careful in the early period after surgery, regardless of the technique. For example, I can present very different examples to you. I had a young patient who opened his ear while wrestling with his father after surgery. This is a new trauma. A week after the surgery, he felt so good that he opened his ear while joking and playing with his father. Or I had a patient who caused their ear to open by catching it while taking off a tight t-shirt or undershirt, causing trauma. Therefore, in the early stages, we must need to be more careful when getting dressed or moving around. Aside from that, to summarize, I can clearly state that I have never seen an ear I operated on fully revert to its original state. Small openings of 1 to 2 millimeters. Classic is 1 to 2%. Thread lift is 5 to 10%. However, in any case, your problem is not unsolvable.